Good morning. I am Dr. Yogesh, Professor and HOD, Department of Physiology, Sri Chamundeshwari Medical College Hospital and Research Institute, Channapatna. Okay, now next experiment what we are going to continue is recording of the normal blood pressure. And here we have our lab technician, Mr. Shivlingaya. So we thank him very much because he is going to be the subject for all the other experiments. We are going to learn a lot of things because he has agreed, and we can learn all the steps and let us not do any mistakes. Okay. So in this experiment, when you take the stethoscope, you should know the parts of it. This is the earpiece, the chest piece, and in the chest piece you have the diaphragm and the bell. One common mistake many feel that when you turn the particular stent, when you wear the stent, also many do a mistake, because when you open the blades and when you wear it, make sure the blades are directed forwards and downwards like this, because our ear canal is also designed like that. When you wear it reverse, what is happening? The ear canal is directed like this, but you are wearing in the opposite direction. It's not going to give you a snug fit. Okay. And here, when you tap and see, if you when the sound is not good enough, you are going to turn it. And many tell that I'm on the stethoscope. In stethoscope, there is no on and off. When you tap and see, if you hear it nicely, it means the diaphragm is active. Otherwise, the bell is active. Okay, we use bell to hear for the murmurs, which you are going to learn when you start going to the next subsequent years. You are going to learn about it. The other things here. So this is the BP cuff, the arm cuff. The name of this cuff is Riva Rossi cuff. Again, tying the cuff is important. When you feel on one particular side, you can feel there is something inside. But on the other side, when you feel there's nothing, I can just feel the opposite cloth layer. Then what is there here? I can feel it starts here and it is ending here. So this is the rubber bag present inside the cuff. Always you have to hold the starting of the rubber bag, end of the rubber bag. Okay. As the camera person comes closer here, I will show you. Tying of the cuff. Hold the rubber bag. The rubber bag should always compress. Try not to have any clothing on the area where you are applying, and hold the cuff. Cuff should sit from the front like this. Okay. Wherever this tubing is does not matter. Because if I've seen some of you, what you will do, you'll keep the tubing in the front like this and try to keep the cuff and continue. Now what is happening, if I take the tubing in the front, the cuff is actually compressing it from the side like this. This will give a wrong BP measurement. Okay, because we are trying to compress it from the front against the bone behind. That is the idea. So always keep the cuff like this, place it in the front and just simply complete the turn. Only thing what you can make sure is, so because of this, what happens, for placing the steth also, there is no obstruction at all. Comfortably you can place the steth and continue with the measurement. If you see in the hospital side, sometimes a BP machine is attached behind the bed. In such a case, when you tie the cuff, the tubing will not be below. It will be above. Okay. So wherever the tubing is does not matter. Understand the concept. We are trying to compress the artery from the front. Okay. So there is one thing. Procedure, I think you know about it. I'm not going into the details of it. Once again, here you have to know the definition of blood pressure. What is the normal value? Any gender difference, if at all. For any experiment, I'm telling this for general, not for this particular thing. Generally, if there's any gender difference in any of the experiments, you should know what is the reason for this. And wherever if it is above the normal, what are the conditions? If it is below the normal, what are the conditions? So that is about the blood pressure. Thank you.